All right, if you've been watching all morning, you know we're kicking off Heart Health Month, and all throughout February, we'll showcase different procedures that can help with various heart problems. Many patients with heart issues will at some point need a heart catheterization. And as CBS 21's Lara Greenberg explains, that can be done several different ways.
It used to be that a heart catheterization would go through the leg or groin area through the femoral artery. But these days, just by using a different part of the body, it can be much less invasive and just as effective.
The following segment is sponsored by Geisinger Holy Spirit.
Heart problems run in Joe Heffernan's family. For him, the journey started 7 years ago.
I had 2 small heart attacks and 5 stents.
The most recent incident happened while he was in the operating room. Joe just so happens to be a nurse who works with heart patients.
Actually, I was at work doing a heart procedure on another patient, and I actually got some chest discomfort and got a little sweaty.
Immediately after, he got help. Ultimately, doctors determined he'd need another heart catheterization, and Dr. Aditya Sharma was the cardiologist to do it.
Commonly, these procedures called heart catheterizations are done through the artery in the leg called the femoral artery.
But to do it through the femoral artery, the patient needs to lie down the whole time, which can lead to complications, including bleeding and even death. So Dr. Sharma sought a different way in, through the radial artery in the wrist.
And the complication rate is lower in the sense of bleeding complications. As you can imagine, the artery in the arm is much smaller than the leg. But for the operator, it's much more difficult.
That's because the curves that go to the heart are different. And because it's a newer technology, the materials for the radial catheter are less developed. But Joe's procedure was a success.
I've had them done through the groin and the wrist is much better. The risk of bleeding is much better. You don't have to lay flat for hours. My first cath, I laid flat for 8 hours after the procedure.
Joe hasn't had any issues since the procedure, and you can't even see a scar. Plus, it gives him something to talk about with his patients.
It's much nicer for me that I can actually tell the patients, hey, this is what's going to happen. It's not as bad as you think.
Dr. Sharma says the procedure takes just 20 minutes and recovery isn't much more than a day or two. With this week's Doc Talk, I'm Lara Greenberg, CBS 21 News.